All right, I'm gonna ditch these because I got nothing but fog. All right. Good morning, everybody. It is indeed a good morning in the sense that we are doing what we need to do to fight this battle for COVID. And that is getting shots in people's arms in the communities that are most affected, communities most needed, and that's all of New Yorkers. So I'm very pleased to be joined. My name is Therese Dominguez. I'm the Commissioner for Transportation for the state of New York. I am very pleased to be here with Mayor Sheehan of the great city of Albany, our capital region here, our County Executive Dan McCoy, Ms. Shakita DeArbro, who is the Housing Authority Executive Director for Albany. Very, very good to be here this morning. So, thanks to Governor Cuomo's leadership, New York has established the most robust COVID testing apparatus in the nation. And we did that starting last spring. We conducted hundreds of thousands of tests per day, and now we're doing the same with vaccines. This is the largest governmental operation in our lifetimes. And under Governor Cuomo's direction, New Yorkers are stepping up to get all of our neighbors vaccinated. At the onset of this state's vaccination effort, Governor Cuomo made it a priority to reduce barriers to vaccination and to ensure an equitable distribution of COVID-19 vaccine, especially in communities that were hard hit by the virus. It's no secret that Black, Latino, and underserved communities were and continue to be the hardest hit during this pandemic. But thanks to the efforts of the governor and the state's vaccine equity task force and the diligence of our local officials, we're addressing this issue head on, setting up and running state-run vaccine centers all across the state to make sure that we've got the resources in place to facilitate public vaccinations fast and equitably. Just this week, 35 new vaccine sites have come online at NYCHA senior housing developments, public housing sites, churches, and communities across the state. The church-based vaccinations and community vaccination sites like the one we have here provide safe, quick, and easy access for all eligible New Yorkers to receive the vaccine and to make sure that we're critically addressing those that we vaccinate across the board. We want to make sure people's lives get back to normal as quickly as possible. And following a successful pilot for these efforts last week, these types of pop-up vaccine sites are being replicated in other churches and public housing complexes throughout the state. Already 9,000 New Yorkers have been vaccinated through this effort. And with these additional sites, 25,000 more New Yorkers will be vaccinated. 25,000 more vaccinations in arms. Appointments are scheduled directly with the host site or the partner provider. And in the days and months ahead, the Vaccine Equity Task Force will continue to work to make sure that New Yorkers receive accurate information relating to the COVID-19 vaccine so that the vulnerable and underserved communities are not left behind and that all New Yorkers are indeed protected. We're going to need an all-hands-on-deck approach to make this operation a success. But I'm confident that this team here, across the state, we're going to get this done. But we also need help from the federal government because we need to expand the population of people who need to get access to, or who are eligible to vaccines. And we need to increase the distribution points. We've done that, but we need more vaccines. In fact, more than 7 million New Yorkers are eligible, but we now are only getting 250,000 doses of the vaccine a week, and we need more. Simply put, we need the federal government to increase the supply, and thankfully now that we have competent leadership in Washington, we're very optimistic that this indeed will happen. We've seen that already over the course of the last 10 days. The bottom line is that this is a war. The governor has characterized it very, very directly. We're fighting a war against this virus. Our main tool, our main weapon in fighting this virus is a vaccine. making it available to everyone in an equitable and just way is what we're here today to do, and to make sure that every New Yorker has access to the COVID-19 vaccine. Thank you all very much. Appreciate everyone's efforts. And with that, I'll turn it over to our mayor for the city of Albany, Kathy Sheehan.
Thank you so much, Commissioner. Thank you for your leadership, and thank you for the work that you're doing to fight for an equitable distribution of this vaccine. You know, as you said, this has been an effort unlike any other that has been undertaken, and it is not without its challenges. And we've learned early on that there is a big challenge in getting the vaccine to communities that have been most disproportionately impacted by this virus. And that's a combination of things. It's a combination of accessing the sites that are set up for vaccinations. It's an issue of some hesitancy and the need to really talk through what this vaccine is with a number of people, particularly our seniors. And it's a question of how do you ensure that when you are allocating that vaccine, you know it's going to be used quickly. And so we very quickly came together, and I cannot thank the county executive enough for the teamwork that we were able to pull together to say we will find a way to do this. And the governor's office has been so helpful and so supportive of this effort. What they said to us was, if you can figure this out, if you can help us to collect these sites in places where we know there are vulnerable seniors, we will get you vaccine. And the governor delivered on that promise today. And we're seeing this, and this is the beginning of an effort to ensure that we are getting this vaccine distributed equitably, not just in the city of Albany, but really across this entire state. That's the commitment that exists at the state level and at the local level, and we've demonstrated today that you can do that when you work together. And I cannot thank enough another partner in all of this. We reached out to our Albany Housing Authority and said, will you help us to work within the various residences that you have to identify seniors and to make sure that we are ensuring that they get on the list, right? And so we need to have those trusted communicators to be working with our seniors in order to do this. So this was an all hands on deck effort. There are many more people, but because of COVID, we've limited the number of people here. But I want to thank our county legislators, Carolyn McLaughlin and Wanda Willingham. I want to thank Joyce Love, who's a council member. I again want to reiterate the partnership and a number of city employees who stepped up and you know, were willing to take on additional work duties to make this happen. So this is a great day. This is a great example. And we believe this is just the beginning, and it would not have been possible without the collective effort of our governor, our county executive, and the many, many people who you see behind me, and many, many more who came together to make this happen. This is a lot of work. This is going to be hard work, but when we work together and we problem solve through it, we've demonstrated that we can be effective and that we can be successful. So thank you so much, Commissioner. I'm so grateful, and I don't know if you're coming back up or am I introducing?
Would you like to introduce?
Okay. Without further ado, a person who I have spent more time on the phone with than I think either of our spouses would appreciate, our County Executive Dan McCoy.
Thanks, Mayor. I'm glad you said that, Mayor, because my wife does not believe me. I'm on the phone with you all the time. It takes partnerships, and it takes people working together. And I first and foremost want to say to Javon and Mohawk Ambulance, thank you for thinking of this. Thank you for putting it all together. And they really did a lot of logistics. And I know I don't want to steal his thunder, but to get the trailer that can take over 100,000 8,000 vaccines, cost you $100,000, says a lot of the commitment from Mohawk Ambulance. And it wasn't just about Albany County, it was about the Capital District. They're based out of Schenectady, they're in Rensselaer, they're all over. And so when we pitched this plan and we got together months ago, it was in a partnership to say, how can we do this effectively? How can we get it into the arms of people that can't get out? Because I've said this time and time again, there are seniors today that are at home, almost been home for a year now, haven't left their house, haven't gone out, stayed home. and they want to get the shot. They don't want to take transportation. They don't want to get in an Uber, Lyft, or a taxi cab. They don't want to get in their own kids' cars. They're afraid. And they're doing the right thing. So it's our obligation in government to do our right thing and get the shot to them and make it convenient and do it on an equitable base. And I got to say to the Governor Cuomo, thank you for his vision. To the governor, getting in the concept that we were trying to do here with Mayor Sheehan's office and my office, and trying to figure out how we can do this and do it efficiently. So, Governor, thank you for believing in us. Thank you for launching the site here. And this is just the beginning, because we're going to be in Cohoes and Watervliet housing as well. Into Albany housing, thank you, because without everything that you've done with your new leadership and just really taking over, how long you been there?
6 months.
6 months. Great time to pick a new job. So, but again, thank you for your leadership at Albany Housing and making sure that everything's gotten done. And again, without working together, this wouldn't have happened. To everyone in my office that made the logistics happen, to Mayor Sheehan's office, to all her personnel. There was a lot of hours, a lot of heartache back and forth to make it happen. But again, in our leadership from our DOT commissioner, from a bridge going exit 3, I believe, I hopefully said that right, into this, you've been a great partner, and we're lucky to have you here, not just in the state of New York, but here in Albany County, for what you do day in, day out for us. And I really mean that. I do want to say this before I end. I cannot thank the governor enough for getting us this vaccine. There's going to be 800 going out in the next couple of days. You're going to see 1,000 more. Mohawk and Javon will talk about it. They can handle a lot more. We need the supply. We have the demand, we need the supply, and it's about, again, taking care of people over 75, 65. Because I want to say this, I know everyone wants to get a shot, and I know we continue to open up categories, but there's still people in 1A that haven't got it. There's still a lot of seniors over 75 that have not got the shot, and there's still a lot of seniors over 65. I'm just saying, keep doing the right thing, wear your mask, stay 6 feet apart, cough into your arm, but give us the opportunity to give it to somebody that needs it. And today is another example of getting into the black and brown community that this has unbelievably affected more than anyone else. So again, to everyone, to the partnerships, thank you. I don't know if you want Mohawk to come up first, or you want to take over?
Is it me?
Oh,
Okay.
I'm sorry. Our great new housing commissioner.
Thank you, County Executive Dan McCoy. I appreciate that. Thank you. Good morning. It's a pleasure to be here with you all today. I want to start by thanking Governor Cuomo, County Executive McCoy, Mayor Sheehan, Chairman Whalen, Mohawk Ambulance, the Board of Commissioners, my staff, and all of our partners here for their leadership in making today possible, and for helping make sure the vaccine is distributed quickly, efficiently, and equitably. The COVID virus has devastated New Yorkers in every corner of our state, but our communities have suffered the greatest losses. Thankfully, the state has made the equitable distribution vaccine a top priority from the very beginning. And sites like this will play a key role in getting every single New Yorker vaccinated and ensuring that no one is left behind. As the governor has said, the vaccination effort is one of the largest governmental operations in our nation's history. And just as it did with testing, New York State is showing the rest of the nation how it's done. We are so excited to be a part of this effort, and I want to thank all of our partners and everyone here today for their hard work, because we know we can only beat this virus if we work together. And a special thank you again to the Commissioner. I appreciate all of your efforts, and I want to thank everyone again for being here today and enjoying this beautiful day as we work hard to ensure that our community and the people in it are vaccinated. And without further ado, I would like to introduce Javon Cruz, Director of Mohawk Ambulance. Thank you.
Morning, everyone. Thank you for having us here today. Thank you to everyone that made this possible. I'll try to make this quick because it is kind of cold out here and we have a lot of people to vaccinate inside. Thank you to the governor's office, County Executive McCoy, Mayor Kathy Sheehan, Public Housing, everyone that's been listed here today. We are very proud to, start this mission. I won't say accomplish because we have a long road ahead of us, but we're looking forward to doing what we do best and bring the best level of medical care right to the patient's doorstep. Quite honestly, all of it is worth it. The investment is worth it that Mohawk Ambulance has put into this. Just seeing the faces of all these individuals behind me, inside these residents, truly showing their appreciation, saying thank you, tearing up, that this is kind of the beginning of the end. So I echo what everyone before me has said. Thank you to everyone that's made this possible. I ask everyone to be patient with us. We have a long road ahead of us, a lot of people to be vaccinated, not a lot of vaccine. So thank you again to everyone, and we'll talk very soon, and hopefully when all this is over, we won't be wearing masks and I could actually see everyone's faces. So. So Mohawk has spent right around $100,000 at this point. We've purchased all different kinds of pharmaceutical grade freezers that can handle Pfizer, Moderna. At the ultra cold level, at the freezer level, refrigeration level, we have portable units inside the trailer. The trailer itself has its own generator with heat, electricity to manage not only the refrigerators, but if we go somewhere that doesn't have a great site like this, we can use the trailer itself and kind of make it a walk-through kind of clinic. We've hired on 50 additional personnel. We have another 50 in the queue that hopefully if we get more vaccine, we can bring them in and make our staff 100. That's in addition to the 250 EMTs and paramedics we already staff that are all already qualified to do this. Tables, chairs, all the little investments that a lot of people kind of don't think about, but we can pretty much set up shop at any given location, any size space, and the operation grows and shrinks depending on the size and the population of where we're going out to vaccinate. So.
Is it kind of full circle for your EMTs and paramedics who were probably, 9 months ago transporting COVID, but still transporting COVID positive patients, caring for people suffering from COVID? Is it a full circle moment for them to now be able to give people the shot that will keep them running up in the back of your ambulance?
Like I said, it's the beginning of the end. Our guys, our EMTs and paramedics in the field are still very much, waist deep in it. We are transporting COVID positive patients every day. A lot of them we find out after the fact, they get tested at the hospital, then we get notified, hey, that patient you had is COVID positive. The numbers are getting better. I won't say they're completely gone. So exactly what County Executive McCoy said, we have to be vigilant, wear your mask, stay distant. I think they all fully understand where we are. It is kind of a full circle, but again, we're a long way from the end. We're extremely proud. We're extremely excited, to finally be here. We're still very stressed out. There's a lot of sleepless nights, a lot of planning. Again, thank you to the, Albany City and Albany County Housing Authority. They definitely did a lot of the legwork and scheduling. But it's a really fulfilling moment. But again, we still have a long way ahead of us. I don't want to get too excited, too proud, and I'll save all that for when we're over. Any other questions? All right.
You can tell this is a total all hands on deck approach, from the state effort to set up the vaccine sites to the incredible amount of collaboration, partnership across the board at every level of government. So thank you all very much. Thank you all very much for participating today. In case you're wondering where the Department of Transportation, just a quick anecdote, we're part of the governor's all hands approach. Every state agency is involved. Department of Transportation has been helping set up a number of vaccine sites across the board, across the state. This is yet another collaborative effort, and just very proud to partner with the governor's leadership and with all of our partners here. Thank you very much.